It's not exclusive to this region, but 14 of the 17 counties here are identified as lacking sufficient healthcare providers. SUNY Upstate's PA program was developed in 2009 as a direct response to these needs. Well, they're at it again because we still have the needs. They're doing it with their PA program. Joining us, Maggie Moore, Upstate's Interim Admissions Director. Maggie, thanks so much for being here. Really appreciate it.
Thank you for having me. I'm really excited to be here today.
Let's start with a really basic, simple one. What is a physician assistant? A PA, as I guess most people break it down to. What do they do? Who are they?
Yeah, that's a great question. So physician assistants, or PAs, are highly qualified licensed professionals who practice medicine under a physician. So they might take your medical history, perform physical exams, order and interpret test results, perform clinical procedures, and formulate patient treatment plans.
So what did we bring you on here for today? What is SUNY Upstate doing now with its PA program to make it even easier for students to get in? Because we need a lot of people in the healthcare field for sure.
Yeah, so we're doing two things. We have a new early assurance program, which allows exceptional and motivated students to apply for and secure a seat into our PA program at the end of their sophomore year of college. And then we're also removing the GRE requirement for all of our applicants, so early assurance and regular. And then we are currently accepting applications for the early assurance program until June 15th.
So let me break down two of them for you. So the early assurance, you can do it after your sophomore year in college. What normally is it? So is that like an advancement of like a couple of years? What normally is the case?
Yeah, so typically you would apply after you graduate with your college degree or that senior year. And it's a much longer application process. Applicants typically apply to multiple PA programs, and of course there's a cost associated with that, an interview process. So this early assurance program really cuts down on time and money for our applicants, and of course offers them peace of mind because they have a spot waiting for them when they graduate.
We talk a lot in acronyms, and to us they all mean everything, you know, right? But why waive the GRE requirement? What is that, and why are you waiving it in this case?
Yeah, so you're right. We do talk in acronyms a lot in higher ed and in medicine. The GRE stands for Graduate Record Examination. It's a standardized exam. It's similar to the SATs, but for graduate school. We waived the GRE requirement to remove unnecessary barriers for our applicants. This helps promote inclusivity, and historically, the GRE has been a barrier for those from non-traditional backgrounds. And data shows that the GRE doesn't always correlate with how successful someone is in our program and programs across the country.
So we talked about it at the beginning. There's clearly a need in many facets of healthcare, not just our region, but since we're here, obviously, for us. How do these kinds of things, early assurance, waiving GRE, getting essentially more people into the program and getting them started early, how does that help our entire healthcare system in this region?
Yeah, that's a great question. So PAs really benefit our healthcare system by increasing access to healthcare, especially primary care. It reduces wait times for patients and improves patient outcomes. So this is particularly important in our rural areas in central New York and underserved areas.
I want to make sure I get this in. Let's go through some of the details. What should people know about applying to the program?
Yeah, that's an important question. We do have required prerequisite courses for the program. Applicants need to have a bachelor's degree or be working towards one. So if you're in the early assurance program, you'd be working towards that bachelor's degree. And we need our applicants to have some healthcare experience. We do have virtual and in-person events throughout the year where those interested can learn more about our programs. And my colleagues and I also do one-on-one advisements, in person or virtual, where we will meet with prospective students one-on-one, sometimes several times before they get here, and guide them through the process of applying. Anyone interested in a pre-advisement can schedule one on our website, which is upstate.edu/perspective, or they can email us at admiss@upstate.edu, and that's ADMISS@upstate.edu.
All right, I got about 30 seconds. I'm going to try to squeeze this one in. What kind of opportunities does a PA have once they complete the program?
Yeah, our graduates have many opportunities to work in pretty much any setting of their choosing. Family medicine, emergency medicine, to dermatology, and everything in between. And many of our students receive job offers before they even graduate. So it's a really great career to go into.
Yeah, that's really good to know you have a job. So you can know before you finish school that you can get into this program, and before you finish the program that you have a job.
Absolutely.
That's great stuff. All right, you go there, check it out. Maggie Moore from SUNY Upstate. Really appreciate it. The PA program expanding. Thank you so much.
Thank you so much for having me.